Hello, everyone. Thank you all for joining us today. We're just going to go ahead and get started. Just be respectful of everybody's time. So I had put in the chat box, go ahead and type your name, or I guess rather if your name is already listed in your Zoom account, your organization and coalition you're representing today. A little bit about myself, Alana Jorman. I work with Mountain Pacific Quality Health. I have the pleasure of working with some amazing people at Mountain Pacific, and nurse by trade. I've done a little of everything, including coalition work and teaching nursing students and working in the hospital, working in nursing homes. So jack of all trades, master of none, they say, huh? So this is a 4-part series. This session is 1 of 4. The next one is June 18th. They are 30-minute sessions. The webinar registration showed you at an hour. I'm leaving 30 minutes at the end for open discussion and just some resource sharing for all of us. So if you are able to join, go ahead and stay on that last 30 minutes. But by all means, if you need to jump off after 30 minutes, I will not be offended. Just some housekeeping items. This is a meeting format. So if you are not speaking, please make sure that you are on mute. And if you do turn your camera on, just be mindful of what we're also seeing. A little bit about Mountain Pacific. So we are a quality improvement organization. Our company is a nonprofit, but we have federal contracts with Centers for Medicaid and Medicare. And the bulk of our work does come from this contract. And so part of that is working with community coalitions. So we get the pleasure of working with most of you guys. So I just want to again thank you for taking time out of your day and joining us. I see we've got quite a few different organizations here. And I want this to be interactive. So if you do have questions, comments, please type them in chat. Some objectives today, we're going to just talk a little bit about what is a coalition, how it's some difference from collaboratives or consortiums, what a coalition's for, stating the mission, vision, purpose, who's on the coalition, how do we align goals and priorities, when does a coalition meet, where and how the coalition meets, and why, kind of what the call to action is for coalition work. So let's start going through some of these terms. So all 3 terms are commonly used interchangeably for the purpose of explaining how a coalition works and runs. But to define them more, let's go through the definitions. It's really not imperative that your coalition has the actual word coalition within it, but it should indicate to the layman what it's for. For example, an opioid task force. So consortiums generally have a financial or shared risk involved with the organizations or people involved, whereas a coalition identifies goals or objectives that the members collectively work together and may not benefit every single coalition member, but the strength as a whole is how the coalition work gets accomplished and successes are measured for a coalition. So a collaborative is similar to what you may see in an affinity group under coalition work, but collaborative is geared more towards an educational industry. But the point of working collaboratively is one of the same: information and resources sharing to achieve a common goal, as I show in the definition of a coalition. So coalitions may be loose associations in which members work for a short time to achieve a specific goal and then disband. They may also become organizations in themselves with governing bodies, particular community responsibilities. There may be some funding and permanence. And they may draw from just a community, but they may draw from a bigger area such as a region, a state, or even the nation as a whole. So regardless of their size and structure, they exist to create and or support efforts to reach a particular set of goals. And such examples are influencing or developing public policy, usually around a specific issue, changing people's behavior, reducing smoking or drug use, for instance, building a healthy community. And this term generally refers both to the community's physical health, which may include not only medical and preventative or wellness services, but the environment, community, planning, housing, hunger, substance abuse and other factors, and its social and psychological health. Encompassing diversity, education, culture and the arts, violence prevention, youth development, employment, economic development, mental health, and other human services, just to name a few. It may take a coalition, either initially or over the long term, to design, obtain funding for, and/or run a needed intervention in the community. Gathering all the players involved in a particular issue can result in a more cohesive and comprehensive intervention. Rather than duplicating their efforts, organizations can split up or coordinate responsibilities in ways that afford more participants access to programs, and it allows for a greater variety of services. So this diagram here, I'm just going to explain a little bit. In 1965, Bruce Tuckman, he's an educational psychologist, developed one of the most influential models for group formation. Based on his observations of group behavior in different settings and on literature study, he came up with a model representing the different phases groups need to go through to grow as a team. All stages have their own focus. They also correspond to a different set of feelings, behaviors, and group tasks. According to Tuckman, raising awareness about the different stages and why things are happening in certain ways could positively influence the team's process and productivity. There are 3 distinct occurrences that usually occur for each of these stages, which are feelings, behaviors, and team tasks. So let's talk about the forming stage. In the feelings part of that, that's in which the member will be excited, they may have anxiety on how they'll be helpful, and then the behaviors is also a consideration in which members will often ask a lot of questions, again, uncertain on how the work will get done. And last under forming is team tasks. And this is where the mission, vision, and purpose fit in. Orientation and kickoff calls usually are beneficial to help understand the goals, expectations, roles, responsibilities for all members. In the storming stage, the feelings are generally directed at how to respond to differences and how to handle conflict. And the behaviors may exhibit some frustration, and the mission and vision and goals for the group, they may need to be reevaluated. In the team tasks, it may help to encourage good conflict management skills and define more of the team's goals, roles, and achievable tasks to help ease the frustration and/or confusion. Norming stage, this is when the team will begin to feel more cohesiveness and a sense of productivity. Feelings may be acceptance of the variety of opinions, experiences, and communication styles. Behaviors generally will show willingness to work together to find solutions, and by this time, there may be some common lingo, maybe a joke or two, that may be developed to create that team's sense of their uniqueness. And the team tasks, the work accomplished and goals that were set and agreed upon may need some reevaluation to help direct the team for the next action steps needed for that goal. In the performing stage, most of the team feels a sense of confidence and satisfaction, knowing that as a team, progress is happening and there's a positive feeling. Behaviors may also result with other team members essentially, quote unquote, stepping up to the plate and seeing the differences and appreciating them by taking on more roles and responsibilities for the team. And for team tasks, significant progress is notable, and the members as a whole see the greatness and find ways to celebrate the achievements. For the last stage, which may or may not occur with all teams or groups, is the ending of the work, the mourning stage. The team may feel little uncertainty or just pure deep satisfaction of the work completed. The behaviors, they may result in decreased productivity because the work that was focused is now gone. For tasks, just as any project manager will say, it's important to ensure all loose ends are tied, reports and deliverables are completed and closed, a good evaluation of work, citing all the lessons learned, the best practices, good takeaways are noted, and last but not least, celebrate and acknowledge everyone's contributions and job well done. So we have a polling question here. And Mary, if you want to bring that up. And the question is, what stage do you feel that your coalition is currently in? So go ahead and type your response. And if you're comfortable, go ahead and type in chat why you feel that your group or coalition is in that stage. Give you a few minutes here. So far we've got 7, 8, getting some good responses in here. And if you're unsure of what the forming stages are, what the stages mean, forming was excited, kind of anxious. Storming is generally directed how to respond to differences and handle conflict. Norming is when more cohesiveness and sense of productivity. And performing, that's when there is a sense of confidence and satisfaction, usually. And then the morning stage, which may or may not occur, is when just deep satisfaction, our work is complete. So we have 23 of 38, we got 60% voted. Right, a few more seconds here. All right, let's pull up the results, Mary. So a lot of it, we got some good results here. So we have some that are forming, some storming. So in the chat, like I said, if you are comfortable, oh, I think I need to share that, don't I? All right, can you see the results here?
Yep, we can see them.
Okay, perfect. All right. So moving on here.
Alana, quickly,
Yep.
you have a question coming from the chat. Is it possible to have morning in the forming stage?
You know, I would say yes and no. I guess if you're newly forming a coalition based off of one work that's ending, maybe there wasn't enough satisfaction, or the work that was supposed to be accomplished maybe didn't get done. But I would say most times if you're feeling that morning, there is going to be some sort of anxiety and a little bit of apprehension in that first part of the stage when you're developing a group together, just because there is a lot of uncertainty. You got a lot of dynamics going on, you got a lot of personalities, a lot of skill sets. So it's okay and it's normal to feel some apprehension at first. Does that answer your question? And by all means, yes, you're welcome. By all means, if anybody else has some input or experiences, go ahead and speak up. All right, so let's talk about the what and who. So the mission, vision, and purpose are all critical to the formation and sustainment of your coalition. Department of Health and Human Services conducted a study in 2012 of over 200 community coalitions nationally. And what they found was, quote, prior research supports this approach with evidence showing that community coalitions can fulfill 3 main functions: create collaborative capacity, build community capacity, and foster change at the local level. They did also find that influence social change and improve the health of communities by creating new programs or services, developing new or more coordinated systems or infrastructure, advocating for stronger policies, in influencing individual health or behavior, and disseminating products or materials, among other activities. So I'm sure some of these activities or events may sound familiar to what maybe your coalition has done or is working towards. Also using S.M.A.R.T goals to help identify the opportunities to improve outcomes within your community helps to focus and clarify how you need to focus your resources. And resources include people as well as monetary resources. So be sure that this is decided collectively with your members. If you're newly forming a coalition, then the organizations will need to dedicate the efforts needed to understand what opportunities exist with the resources that are available. And you can utilize, we had a toolkit from our last scope of work with our CMS contract. And in that toolkit, there was an organizing sentence. And that helps to identify as a leadership team for your coalition. And I'll show that in the next slide. Some key factors that affect coalition functioning and sustainability are leadership, membership, structure, vision guiding action, funding diversity, sustainability planning, and contextual factors. So this is just a little snippet of that toolkit, the organizing sentence. So it doesn't show the entire thing, and we can definitely send that out after the training today. So directions, what are we are organizing, and you can see in the parentheses there who gives an example constituency. And then to the what, there's a measurable aim. So if this toolkit looks useful to you, or this tool right here, there's more templates and guides and things like that. And like I said, during the last 30 minutes, we can definitely go through some of the toolkits and show you guys what examples are in there. So to create or reevaluate your mission statement, this statement, the mission, should describe the purpose of the coalition existence. Should be a succinct statement that is unique, realistic, and keywords to make it memorable. This is the why you are meeting. The vision, this is a statement of where you want to be, where your efforts want to lead to. Be, again, realistic, clear, descriptive, and above all, consistent. And then purpose, essentially the how in your coalition work. And keywords often include, as you can see in this example, build, sustain, improve, educate, engage, and so on. So let's talk a little bit more about S.M.A.R.T goals. So as you can see, there are different versions of the word to spell out SMART. But the point is, just like we discussed, coalition, consortium, collaborative, the purpose is the point. S.M.A.R.T goals help lay out details to level set your team or coalition at the right time with the right resources. So let's go through them. S is for specific, and in terms of goal setting, think about this as your mission statement for your goal. It's not detailed, but if you ask common questions such as who needs to be involved, and who is it for, and what exactly you're trying to accomplish, is there any contextual factors that you may need to consider for your goal, and the root cause of the issue. Why are you working to find that solution? M is for measurable. What kind of data or metrics are you going to use and have access to? If this is a long-term goal or a stretch goal, understanding what certain phases in a timeline will need to be considered and mapped out within your goal as well. A is for achievable. How attainable is your goal with what resources and time your coalition has? I think it's important to keep the frame of mind to realistic during every single element within a S.M.A.R.T goal. You want to achieve success, not encourage failure. R is for relevant. Since by this time of defining how to move forward with your coalition, you should have already identified the mission, vision, and purpose for your coalition. Is this goal still relevant to the scope or tasks your coalition can realistically achieve? T is for time. If your goal or goals are complex, map out a timeline so it's important when it comes time to divide and conquer. If you are good with delegating, tasks can be easily identified and prioritized. And then having defined time constraints also puts some accountability to your work. So this is just going through quickly a charter and roles and responsibilities. So a coalition charter helps to keep people on the same page for what the mission, vision, and purpose are, and help keep that focus, and you're accountable over time. Also defining your roles and responsibilities so members know what their expectations are and what you can expect from them and what they can expect from you. And then it is a good idea to require the members to sign the coalition charter annually. So this is an example charter, and thank you for some of the awesome people at Mount Pacific that helped to put this together. This is an example coalition charter document. So establishing a solid structure and plan for your coalition as early as possible and referring to the agreed upon direction helps give ownership and meaning to your coalition. To understand why a charter is important, let's first talk about the definition. So looking through various definitions, a good summarized way to describe a charter is a document to describe the objectives and goals, the scope of the project, and what type of task the team is going to take responsibility for. Setting a charter in place early helps to prevent confusion and other tasks the coalition did not intend to take on as a responsibility or action item. So not letting that minutia creep into their coalition. As you see in this example charter document, it has the name, the mission and vision, strategies or tasks listed within it. And you don't see the bottom, but it also has the purpose, objectives, as well as participation expectations, roles and responsibilities, meeting attendance expectations, defines what an unexcused absence is to help define who an active member is when it's time if they haven't been to a coalition meeting in 6 months, if that is an active member or not still. It also lists logistical items such as a regular meeting versus annual meeting. And at the end of the document also lists procedural processes and a place for each coalition member to sign on an annual basis. So taking an inventory early on to understand what other entities are already working on your coalition's area of focus helps to reduce duplication of efforts. When you begin to build up your coalition membership, having the right people at the table ensures that efforts are meaningful and value added to stakeholders, to community opinion leaders, to policymakers, and so on. It also helps create a unified voice and purpose to the purpose. Not only reducing duplication of effort, but also inclusion of people at the right time to influence change that the problem or issues affect. So for example, if our coalition were to focus on increasing quality of care through community collaboration, it would involve a network of people working together to improve the health and quality of life in an area or community. We would want hospitals, nursing homes, home health and hospice, clinics involved. But what about a very, very important piece of the community, the patient and their family members? Having a patient or family advisor on your coalition helps to give you that pulse check on what interventions or action items have been in place and the pragmatic reason why they aren't or are working. So Winia and other authors found that partnerships with effective or ethical leadership were more likely to be perceived by their memberships as effective in achieving their goals. Other authors have found that coalition leaders from diverse cultural groups, especially those that reflect the community, are more successful in obtaining community buy-in for coalition activities. A diverse membership brings a variety of perspectives from different sectors, backgrounds, and other constituencies. Another membership factor is with coalition effectiveness and the number of partners in the membership and the amount of time that the member organizations can contribute to the coalition's activities. Coalitions can benefit from having staff members with experience in community planning and organization because they understand what's required to engage the community and conduct the activities to meet the community's needs, so it's realistic. Researchers have also identified the importance of coalition structures in predicting coalition progress. They've noted that the development of structures, rules, and responsibilities early on in a coalition development enables that coalition to operate effectively. The steering committee or executive board, they can be comprised of representatives of the member organizations. They can convene regularly to assess the goals and activities of the coalition. So vision guiding action refers to the extent to which the membership agrees on the long-term goals of the coalition, so the vision, and is committed to pursuing activities or the action that will move the coalition toward the shared vision. Funding diversity, it's a key predictor of sustainability in a community coalition and in organizations more generally. Programs are more likely to survive when they have political, financial, and institutional resources. And resources include money, people, goods, services, and so on. So moving sustainability from a goal to a reality, this requires creating goals and objectives, developing and implementing sustainability strategies, and continuously evaluating those strategies. And then contextual factors may also affect the formation and effectiveness of community coalitions. Contextual factors are external conditions that either exist or are lacking in the environment and thus can enhance or inhibit the coalition's activities. Do I have any questions or comments up to this point? Pretty quiet. So using a unified approach to determine the direction for your coalition often involves getting input from your coalition members. This encourages participation and building rapport and trust within your coalition. Understanding the alignment of goals for external coalitions, groups, organizations, and reaching out to your work collectively and not silo your work, it will yield better outcomes for the resources. Also, by working collectively with other organizations or coalitions, the efficiency of your efforts, they're more evenly distributed and less burden of time is put on your coalition. Also, unifying your voice as a community and not just a community coalition, more is better in this case for change to occur and sustain. And then data is a very vital component of your work as a coalition. If you don't have accurate data to reflect what your gaps are, then how are you going to know whether or not your interventions are appropriate or successful? Data involves multiple angles. So the more diversified your coalition is, the more likely you'll have access to data that helps you put the bigger picture together. So you have an accurate layout of what your gaps and how to focus your resources. Even if your coalition members may not have access to direct data, they will point you in the direction of contacts and key informants to gather what you need. The Institute of Medicine, they also put a framework together to help guide measure development and expected outcomes. They're SAFE, which is avoiding harm to patients from the care that is intended to help them. It's effective, providing services based on scientific knowledge, all who could benefit, and refraining from providing services to those not likely to benefit. So we're avoiding underuse and misuse respectively. They're patient-centered, providing care that is respectful and responsive to individual patient preferences, needs, and values, ensuring that patient values guide all clinical decisions, and they're timely, reducing waits and sometimes harmful delays for both those who receive and those who give care. They're efficient. You're avoiding waste, including waste of equipment, supplies, ideas, and energy. They're equitable, providing care that does not vary in quality because of personal characteristics such as gender, ethnicity, geographic location, and socioeconomic status. AHRQ recommends when you look at what you're trying to collect, it helps to chunk your measures so it isn't overwhelming or overloading your resources. And you can measure by composite, quality domain, like I just reviewed, measure by disease or condition, measure by type, just like structure, process, outcome, or by data source, for example, by medical records, claims, or patient surveys. And there's a lot of other logistical considerations when you start planning meetings. Above all, these considerations listed, consistency and good communication. You have to be consistent with how, when, and where you meet, so you're being respectful of coalition member schedules, and that good communication exists to send out agenda, minutes, updates, postponements, or cancellations, and then if your coalition has any asks or requests of you. Most coalitions do have an organization that will essentially host the meeting spot or provide a virtual link. And this is important to organize early on for your coalitions when you're just getting started, so you have all of this ready. All right, any final thoughts, questions, Let's see, we got some chat here. I have Maggie had mentioned mourning can happen at every stage as some members might leave due to conflict or reasons. That's very true. All members are supposed to be a part of creating goals objectives. How long should coalitions spend on recruitment? I would say recruitment generally is going to be fluid and organic within a coalition. It depends on what type of events or what interventions you're trying to put in place. Somebody that may have helped form that goal may not be the person who needs to carry it out. So it may be fluid, but it's also important that those who are involved help carry it through, if that helps, Adriana. Is it recommended to have a mediator, outside source lead the planning for goals so it is unified and meets the needs of all partners? I'm not sure what that means. Should it identify gaps in existing resources, or should it just justify the need for coalition? I would say if you can identify the gaps when you're forming your coalition, yes, Maggie Oki says, important to do RCA or SWOT, etc., to determine what is going on in the community. I would agree with that. And having all partner input is very important. So you have that collective voice and a really good foundational understanding of what the gaps are and what the needs are. And then that you're kind of essentially doing an environmental assessment to determine, are there other groups or coalitions, consortiums working on a very similar goal? And if they're doing XYZ for that goal, but maybe they're not able to do ABC, maybe your coalition can help contribute to the solution by doing ABC. So you're working collaboratively together as two separate entities, but working together. Good
Right.
question.
Can you hear me?
Yep, I sure can.
So with the statement where I asked about the mediator, what I have learned is that sometimes when you have like coalition, a large group, sometimes some members of the coalition or the work group, they start to feel disempowered if they feel like the people that are facilitating the groups have like even though we can say that we're all here to work towards that, some members may feel like, well, what we're really doing is working towards what you want us to do.
Yeah. And
so
that is,
I was just asking, you know, is it in the beginning stages, rather, when we are going through the process of identifying objectives and goals and activities, would you recommend we have someone that is completely neutral of the coalition of the group, so that it is understood that this is a person that's just trying to make sure we're all just trying to get on the same page, we're all have the same objectives, and they just neutral, like they don't get anything out of it?
I would say I wouldn't discourage it by any means, but it would also provide that opportunity to give you a perspective of, you know, let's say you're doing a healthcare goal. It's something to do with, like, let's say readmissions. But in your community coalition, as a bigger objective and goal and vision for your coalition, it's, you know, to improve the health outcomes in the community. Well, there's other people in the community that have effect on that, such as the law enforcement, EMTs, somebody that may not have stake in the game and the specific objective that you're trying to meet at that time. And they may be able to give that different bird's eye view so that it gives you that that perspective that you're looking for to bring in an external person, but they're still essentially a part of the coalition, that's still part of the community. Does that make sense?
Yes, I follow that. And yes, Veronica, that's why I was referring to an external facilitator.
Yep. And that's something too that, you know, if you get to that point where your coalition is having those struggles, you know, going back, that's why it's so foundational to establish the mission, the purpose, you know, what is your scope of work? What can you realistically achieve? And then using those quality improvement tools, understanding root cause, what is the real cause? Because maybe you're all saying the same thing, but in a different way. You're all trying to meet the same goal, but in a different way, and you just need to get on the same page. And by using structured tools can help facilitate that communication with your members. And we can definitely share tools. And Maggie says, in the beginning of building community, it takes time to develop trust with all members, getting to know them, their needs and goals. That is very, very true. Building that rapport and trust. And like when we talked about when it's the norming stage, kind of having those unique lingo and sayings may have that sense of uniqueness in that coalition. And sometimes if somebody's coming in kind of midway when that coalition may already be at that norming stage, the new person may feel a little bit like an outsider because they don't get the lingo, they don't get the jokes. And so if you have a good orientation or document to help guide them and somebody to help facilitate and catch them up and get them up to speed so they feel like part of the coalition. Very good questions, conversation. So how about for those of you who said you are in the forming stage? Yeah, important point when new member comes in and they get updates on what's going on and etc. And that's a good, good point. Keeping good minutes, agenda items, so you can see what has been done, what's been tried.
So I would speak just to start us off. So I said that we was in the forming stage. I trust the person that's leading that group right now. They have a track record of doing good work. The reason that I talked about the morning is more so I think about, the pressure and like talking to providers, how so many people are overwhelmed with like what's going on in the economy right now, the pandemic. Is that going to affect people, level of participation? Because I firmly believe for a coalition to be effective, everyone has to be committed to it. But I also respect life is happening before our eyes right now. So everyone is not going to be able to give, 100% or even 60%, shoot, sometimes 30%. Life happens. But, it's, that is okay for you to fall off. But if we have so many people that are busy with life and work, how do you maintain that energy? And how do you keep the rest of the group focused so that they don't get discouraged and feel like we're working really hard, but we're not getting to, that next level where we need to be?
Right. Yep. I hear that point very, very loud and clear. We had a telepsychiatry affinity group / webinar the other day, and Dr. Eric Arzubi had brought up a good point. I had asked him about workforce retention, workforce shortage, and how to mitigate that when you're trying to do integrated behavioral health. And to the point that you're making for involvement is when you are able to track and able to show that all of your work as a coalition, you have moved the needle and you have data to show that. I would say I agree with him when that shows the increased morale. That's how you retain and increase your participation and engagement, because you're showing the hard work that you did is showing improvement. It's not just going into thin air, it's actually showing improvement. So how about some of these focus for the coalition? some of these questions. Anybody have input on them? Can an issue be better addressed if all concerned parties working together and a coalition help to accomplish that purpose? So I think that's the bigger question would be how to utilize the resources that you have within your coalition so you maximize the efforts that you're putting out so your outcomes are achieved in a timely manner and that your interventions are sustained. Or do some of your work, does it work to have like a little smaller group to do some of the essential grunt work, and then you bring it back to the larger coalition to help spread? Input on that? Or how about, will a coalition increase the likelihood that all factors impinging on the issue are identified and attended to?
I don't feel like a coalition will increase the likelihood of all factors, but I do think that they could probably address those key factors.
Yep. I agree. And we did put a evaluation in the chat box if you want to provide an evaluation feedback. And Amber said, I think we have lots of coalition metrics and it's helpful to have a steering committee and various work groups. So kind of when we talked about divide and conquer. And this is not necessarily tips and tricks here, but what challenges or barriers has your coalition encountered and how have you mitigated them? Any feedback on that?
I feel like right now for our group, we have the members that are part of our work group, I feel like are solid members. I feel like the ones that are currently participating, they have a heart for it, literally. And they also are very passionate about the work. So the pros are very there. And then a lot of them have been doing the work even before I came into the picture. So they have a lot of that historical knowledge of, and they also are aware of like the evidence-based practices and interventions. What I foresee as a challenge is more so the consistency, because from what I have observed, a lot of things get started. There's a lot of excitement in the beginning, but then it's hard to keep that same energy throughout and make it a sustainable project.
Mm-hmm.
So I see that being a challenge. And then also I see, you know, the concerns of the community shifting. Because right now before our eyes, we see that a lot of people are not concerned. I ain't gonna say concerned. A lot of people got other things on their plate that they're not really putting their health first. A lot of people are trying to figure out how they're going to feed their family right now, how they're going to pay their rent, how are they going to afford their insulin, how they're going to get a blood pressure cuff to like track their blood pressure if they're not working and they don't have insurance and they have all of these other barriers and you got to be 6 feet apart and you know whatnot. So I feel like it's going to be hard to like work with patients because they're not going to immediately think about themselves. They're going to think about the circumstances that's going on around them. And then how do we deal with that? Do we have the training in place to teach people how to deal with upstream factors?
Yep. Yeah, I would say that's a reoccurring issue right now with a lot of coalitions that did exist. Last year, starting this year, and with COVID coming on, the members that joined were coming from organizations that community coalition was not a priority, was not front and center, something to dedicate that time and effort to. And so a lot of coalitions have, have paused, and now moving forward, understanding what the real issues are. And I think what you're talking to with, families trying to feed their, their kids and time and a job. And, I think too, there's a lot of other issues going on. And so I know Caitlin had said in there, time always seems to be a challenge. It's an issue. And when we think about Maslow's hierarchy, needing the basic needs, safety, food, shelter, water, it's hard for somebody to care about doing their blood pressure when they don't have a safe home to go to monitor their blood pressure at home, or have the money to buy food other than hot Cheetos and Pepsi. So, when we start to think about interventions as coalitions, that's, imperative that you have that membership and that perspective of the locality and for the community. So your interventions and the work that you do is meaningful and beneficial.
Kelly Somerville with HMSA. I think that, can you hear me okay?
Yep.
Okay. I think that particularly during this time, that maybe it's time that we realign our goals and take a look at Maslow's hierarchy of needs, and maybe we need to change our focus and take care of things like food insecurity and housing more. And as I look at what we're doing with the managed care organization that I work for, we're realigning our goals, and I'm hoping that we can carry that over to our coalition also, because you're right, nobody who can focus on their blood pressure when they don't know where their next meal is coming from.
Mm-hmm.
And Hawaii right now has a 40% unemployment rate, and we have some areas on the island of Maui that have a 70% unemployment rate.
Wow.
So it's not good, and until we address some of those other issues, we can't even worry about their blood pressure. And if the community doesn't see us responding to those basic needs, they're not going to take us seriously about their other issues.
Yep, I completely agree. You have to really understand, and that I think would be part of your root cause, your gap analysis, to really understand what the issue is. So when organizations work together, and that's the beauty of a coalition, it's organizations coming together with a very like problem or issue and solutionizing together and combining their resources, so time and money and whatever else can be contributed. So you are able to give a wider response to that issue. I think social determinants of health are finally coming on the forefront. Sorry, I had to mute myself real quick. My dogs will probably bark.
Yeah, I just would like to say my name's Mark Maribel. I'm with Mountain Pacific too. And so Shelley and Adriana, these are great comments that you're making. And these are very unique times, whether you're looking at a global pandemic or a global sort of movement going on in regards to how we treat each other and care for each other within hospitals or within police stations or any one of a number of places. And I think you're right that if you are attentive to the community that you're in, and I think once you get past a forming stage, that norming stage is going to pull those kinds of ideas in. And so for right now, we should spend more time on those social determinants that you're bringing up, and they are unique to each community. Where you mentioned 70% of the island of Maui is unemployed. So each area has different places, different organizations, different people working together, food security, food insecurity, food deserts. And I think those are important aspects of a community coalition that when you address them, you find they also relate to how people deal with their own health and how they deal and how organizations deal with them to help try and help them during these time periods. So I love the passion, and it's obvious you care about your communities and you really would like to see this work. And so that's why we're here, is to try to help that. So we want to make healthy communities, and we want communities to find their voice and to share that voice as much as possible.
Yeah, Mark, this is Shelley. You know, the area I'm talking about with 70% is Hana. 70% unemployment, and you know, we're worried about increases in child abuse and family violence, right? So this is all issues that we have to look at, and how can we help?
Right. Yeah, we can't ignore what's going on, and at the same time, we have to also see how does it fit within the perspective of what we're doing. And in some of these cases, it means that that perspective, as you've mentioned, is still warming on the back burner, but the front burner, in order to help our communities and gain that trust that you mentioned, say that this isn't about us, this isn't about CMS, this isn't about Medicare, this is about the health of our communities. And as we go forward with it, it will impact all those other things, but we just need to, as you said, sort of pivot and take a different look. And in some areas, like you said, as isolated as Hana may be, it's still a very important part of all of our lives here in Hawaii, and as I'm sure it is to all the other coalitions in the other states too.
Yes.
Yeah, when we talk about food insecurities and food deserts, Montana, I live in Belgrade, Montana, and at Mount Pacific, we have a couple different works that we work with tribal communities and with the American Indian, Alaska Natives, and I would assume Hawaiian Natives. Just there's that element of inequality with healthcare too, that you know, when we try and move the needle to improve the outcomes for the community, we're trying to do it with limited resources within our healthcare organizations. When you look in a tribal community, they have very limited resources and funding. And then in the community, when you're trying to improve the outcomes, there's very limited community services. And that really affects the morale and the you know, the engagement and feeling of that hope. There is some hope that we can move the needle. But I have seen it work, and I have seen organizations come together, and that's one thing I can say about community coalitions, and why I love working with coalitions is you do have to have the heart, you have to have the passion, and that's where it comes from. That's how change happens. So I appreciate all of you and what you do.
Thank you, and we appreciate everything that you do. And I just want to just clarify, since we just had this discussion, you do think as a coalition, even if our focus, for example, is to focus on blood pressure control, we should make sure that somewhere in our objectives or activities, we have something to identify those barriers for those participants to control their blood pressure. And that's when we will focus on ACEs, social determinants of health. I think that's what I heard him say, social determinants of health, and that whole just like looking at it from a health equity lens.
Right, yeah, to look at it from a holistic standpoint. And, you know, before when I had mentioned patient family advisors, patient family engagement with your coalitions, that helps to give that realistic pulse check on what is actually needed out in the community. Because we definitely bring a perspective when we're coming from a healthcare organization. But when you look at it from the receiving end and you look at it from going in, you know, that's two different perspectives. And so using, you know, standardized tools to really give a good gauge on what you actually need to focus on. And, you know, you brought up ACEs, and, you know, more and more research done on trauma and mental health, and how, you know, there's a direct correlation with an ACE score to chronic disease management. So if you're not taking care of the whole person, if you're not even considering the mental health component too.
And Adriana, I think also the other part is as you start bringing in other types of organizations or different types of controls around, let's say, blood pressure, it's also what matters most as far as those 4 M's that are really out there now for health systems. What matters most to the coalition, and what matters most to the people who are helping you gather information around what it is you're working on. And I think once you get there, you find out that it is a community coalition.
Okay.
That's what you want. Yeah.
I have really enjoyed the conversation and dialogue the last 30 minutes for sure. Does anybody else have any questions, concerns, comments, resources they want to share? Any tools or tips or tricks that has worked for your coalition and in the past has been very helpful?
Alana, this is Maggie. I just wanted to make a comment that in the beginning, when folks are just learning about each other, one of our coalitions put each organization, gave them a time slot where they could do a 15-minute presentation about the history of their organization and, you know, how many staff members are there and, you know, what their interest and contribution in being part of the coalition that they chose to be part of. And that went on every month or every 2 months. We always had a partner member who provided information, and I think it really helped with getting people bonded and just having general information about available community resources.
I love that idea, Maggie. I love that they have that opportunity to share where they're coming from.
Plus, it got them to the table.
Exactly. Yep.
But no, it was perfect. And I was like, well, we didn't know you did that. There was a lot of learning too. And it's like, gosh, you really had that. You're one of the best kept secrets.
Yeah, and you know, it helps too to put the surface lines down there. Like if you need expertise in a certain specialty area, you're like, oh, Jane Doe talked about that. Let's bring her forward. All right, well, I appreciate everyone for joining today. And like I said, the next session will be on June 18th. And I very much look forward to all of you joining that call. And in the meantime, if you do have any questions, concerns, resources you want to share, I'm going to put my email in the chat box. And you can go ahead and email it to myself or to Maggie or to Mark. There's also quite a few different other Mountain Pacific staff on there too. So if you want to go ahead and put your information on there, if you have somebody that you recognize from a coalition, just go ahead and email. Thank you again for everybody, and I hope everybody has a great rest of their week.